chairman from August Pine Ridge, Mr. Fred Reno. A pleasant good afternoon to all. History of UNICEF work in Belize, which includes some of the hardest to reach places to help children grow up healthy and happily. UNICEF mandate is to support countries to help children survive and thrive. In Belize, this partnership that dates back to 1954 focuses on maternal child health programs, especially those such as immunization and health in emergencies. As it has prevailed over the years, through the modernization of Belize health sector. It is appropriate then that today the program is not just a launch and a handing over ceremony, but a celebration of the partnership and the hard work gained for the health needs of the children and mothers of Belize, particularly in the areas of routine immunization and cold chain strengthening. The public health care service of Belize is important because it ensures healthy citizens. As improvement in primary health care service across the jewel emphasize on maternal child health service, vaccine plays an important role in preventing over 12 communicable diseases yet prevalent in our communities. The use of vaccines requires rigid temperature management. Today, equipment will ensure that these international vaccine cold chain management guidelines are realized in Belize. I would now like to take this moment to invite the August Pine Ridge Cultural Group. Okay, so we will put that later on in the agenda. I would like to ask Ms. Acknowledge our invited guests here today with Minister Honorable Kevin Bernard, the Minister of Health and Wellness. I apologize if I may not get the name correct for the Ambassador for Japan in Belize, His Excellency Shikarata, Ms. Alison Parker, UNICEF Representative for Belize, Mr. Fred Renaud, the Chairman, and other members of the Village Council, Dr. Edwin Bolastig, deputizing for Dr. Louis Bell, PAHO Representative in Belize, Dr. Natalie Beer, the Technical Advisor for Maternal and Child Health. Special invited technical advisors and regional health managers from the Ministry of Health and Wellness, including Dr. Angela Gilhari, UN colleagues from the United Nations Regional Coordinator Office in Belize and UNICEF, students representing the August Pine Ridge RC School, the families and community members of this fine village, August Pine Ridge, those viewing us online on CTV3 and Facebook, and the media colleagues, of course. The program cooperation between the Ministry of Health and Wellness was accelerated over the course of the last 3 years as we work together to respond to the pandemic. Subsequently, UNICEF has expanded its health program for children and adolescents in the current country program document 2022-2023. We invite Ms. Alison Parker, UNICEF representative to Belize, to share her remarks. A round of applause, please.
Thank you so much, and a pleasant good afternoon to everyone. Honorable Kevin Bernard, Minister of Health and Wellness, His Excellency Ambassador Nobuyuki Shikirakata of the Embassy of Japan to Belize, Mr. Fred Renaud, the Chairman of the Village and other members of the Village Council, thank you very much for having us here today. Dr. Edwin Bolastig, who's deputizing the head of PAHO WHO, and thank you for being here, demonstrating the collaboration we have as UN agencies in support of the government of Belize. Dr. George Palanco, Director of Hospitals in the Ministry of Health and Wellness, and all senior health officials. The very dynamic Dr. Natalia Beer, our technical advisor for maternal and child health. Our special invited guests, UN colleagues, our colleague also from our UNICEF regional office, who's also here to support us, students representing the August Pine Ridge RC School, thank you so much for being here. This is all about you. Families of August Pine Ridge community, our media colleagues, and those who are joining us online. Today is definitely a day of celebration. It comes out of over 2.5 years of planning, developing, and implementing a very comprehensive investment in primary health care in Belize. The UNICEF State of the World's Children Report, which is what we are also launching today in addition to the handing over, is a flagship report of the United Nations Children's Fund. Very similar to the UN Development Program Human Development Report, this report specifically focuses on special themes and global trends that impact on the well-being of children. Over the years, UNICEF has covered various themes for children, which has included issues of disability, mental health, food insecurity and nutrition, child labor, and so many others. This year, the report is focusing primarily on vaccination. In the Latin America and Caribbean region where Belize finds itself, unfortunately, over the last 2 years, in the post-COVID-19 pandemic, we've seen a deteriorating report on the coverage of immunization. We are formerly one of the highest in the region. However, we've seen a significant dip. The COVID-19 pandemic actually amplified what had already been a downward trend over the last 5 years. These reports highlight that the Latin American region has been on the decline for the last 5 years, but the COVID-19 pandemic actually highlighted this even more. What does this tell us? That in as much as we make important gains in our healthcare system, it is fundamental that we sustain the gains made and help to accelerate them. If we take our eyes off the ball, then the important gains that we've made over the years will be rescinded. The 2023 SOWC, as we call it, State of the World Children's Report, presents findings from a comprehensive assessment of the status of routine childhood immunization. The report highlights key challenges and opportunities for immunization, including backsliding during the pandemic, reaching zero-dose children and missed communities, and the importance of investing in primary healthcare and healthcare workers to ensure increased and sustained investment in immunization coverage. The report, from a global perspective, warns that 67 million children missed out on one or more vaccination over the 3 years of the COVID-19 pandemic due to service disruption caused by a combination of strained health systems and diversion of scarce resources, sometimes conflict or political instability, fragility, and demand issues, some of these to which Belize can definitely attest to. The report also includes an analysis of new data from the Vaccine Confidence Project, which found that more than 80% of respondents thought vaccines are important. The perceived importance of childhood vaccines, though it fell during the pandemic period in 52 or 55 countries surveyed, yet we still consider that vaccination is crucial to the survival and development of children. The report provides some important areas for development and some good news. What are some of the important areas for development? It showed gross inequity between vaccination and the poor. Some of the data showed that families from poor communities, minorities, indigenous and ethnic groups were the most left behind in terms of vaccination coverage. So as we look at the state of the world's children today, and as we really came out to Pine Ridge to be able to be in one of the outstations from the main city, we're actually investing in the most vulnerable and hard to reach. The report also highlights that mothers who are not highly educated tend to miss out. The children of mothers who are not highly educated tend to miss out on vaccination much more. So there's a direct correlation between gender empowerment and the vaccination of our children. This report also makes a very strong call on investing in women's empowerment, gender empowerment, if we are going to see an increase in immunization for children. The report also highlights that when children are not immunized, the risk of falling ill is amplified. And so there are two considerations there. One, that children miss out on school. So school absenteeism becomes high, and therefore they miss out on important learning opportunities in a context where they've already lost 2 years of schooling. Secondly, when children fall ill, the parents also have to take time off to spend at home to take care of them. And so in vulnerable communities where livelihoods are fundamental and sometimes are mainly on a day-to-day basis, because many of the women are in micro, small, and medium type of engagement. If you don't go to work, you don't get paid. And so the time they spend taking care of their children results in loss of livelihoods, which also impacts the children. So today is a day also of reflection. What are we going to do together? What can we do better to make sure that we can reach every child? The good news is there's a lot we can do to catch up, to recover and to accelerate childhood immunization. In the words of the UNICEF Executive Director, Catherine Russell, she said that we have gone through many trials and challenges in the journey of immunization. But in each of the cases that we may have, whether as a pandemic, epidemic, or otherwise, we've always been able to rise above each of them and to make great gains in vaccination. Vaccination is one of the greatest achievements that we have achieved together. And the underlying and pivotal factor for making that achievement possible is the political will of the governments. And for that, I really want to celebrate the Ministry of Health and Wellness for their untiring investment in making sure that we have a comprehensive healthcare system, not only at the primary level, but at all levels. To the minister and his team, I really want to salute you because you have been available at all times, even over the weekends, in order to be able to pull together those important data sets that are needed to ensure that we can have the funding to support you. Let me use this opportunity also to thank our donors. Here we have the Japanese government who was able to support Belize with over $1 million. And that's why you can see some of the work that we'll be handing over today. They have been a long-time partner with UNICEF over the years, and they continue to be a fundamental one. And to the Japanese government and the people of Japan, let me extend our heartfelt sympathy, heartfelt appreciation, on behalf of UNICEF to share how much we appreciate the investment that has been made. I believe when the minister will be giving his statement, he will share some of the important gains that have been made in just a very short period of time, and that has been made possible due to your dedicated support and partnership. As I close, I just want to highlight 3 other key areas. Unvaccinated children are also called zero-dose children. These are those who lack any vaccine. It is measured as an absolute number. So zero-dose children are those children who do not receive a single dose of the very first, the DPT vaccine. Diphtheria, tetanus, and I think the other one is pertussis. The same indicator is used at global, national, and subnational level. Zero-dose children are not only missing out on vaccines, but the indication is that they are most left behind for many other sectors. You will find out that in those communities, they are the ones with the least access to water and sanitation, least access to education, least access to quality improvement in terms of their healthcare, least access in terms of gender empowerment. Unfortunately, in Belize, 17% of our children are zero dose. 1,121 children are missing out on any vaccine at all. In a country of this size, it is possible that we can leave no child behind. They are concentrated in geographical locations, which is Toledo. They spread across the country, but the highest amount is Toledo. I believe that together, with dedicated and targeted investment, we can make a change. And by the next State of the World Children's Report, every child in Belize can be vaccinated. Is that a possibility? I believe so. Finally, what is the cost of not taking action? Unless urgent and dedicated action is taken to restore and rapidly accelerate child and adolescent immunization, there's a major risk that the Agenda 2030 will be lost and will not be realized for a country such as Belize. The Agenda 2030 aims to leave no one behind with immunization and calls on all countries to reduce the number of zero-dose children by half, at least, by 2030. I believe for Belize, we can actually achieve 100%. The backslide has placed us much further behind than we were before the pandemic to reach these targets. The sort of united and unprecedented global effort that is necessary to put this forward is pivotal. And this will take us at national, regional, and global level to make this happen. For us as UNICEF, we have 3 calls for you, sir. First, we need to vaccinate children missed during the pandemic, restore disrupted immunization services, and accelerate progress to achieve the Immunization Agenda 2030. Secondly, we want to ensure and increase equitable, affordable access to and use of existing and new vaccines. Accessibility, affordability is crucial. Can the families access the vaccines? And if so, is it available? Also, is it affordable? Affordability is not just the cost of the vaccine, but the bus fare to get to the facility in order to get the vaccines. The third part is to strengthen our immunization programs to sustainably reach target population with full vaccination and essential primary caregivers. A healthy nation is fundamental to the development of all. And so today, as UNICEF, we are pleased that we'll be handing over a huge assignment of equipment to the government of Belize in order to ensure that we ourselves, as we partner with you, we will be supporting that agenda. And thanks again to the government of Japan for supporting us. We'll be handing over 7 vehicles, 2 of which are on the display. We'll be handing over, we've already installed 15 generators across the country, 1 of which is on display. We will be handing over golf carts for the hard-to-reach communities, and I believe Orange Walk will have some of those. I'm not talking about the distribution plan, I'm just telling you about what we have. We've been able to have over 100 monitoring equipment apps for our cold chain system. So this is monitored and linked to the generators that we have installed. The idea is that should the temperature drop or should there be a power outage, there will be an immediate alert by the regional managers as well as the central cold chain in Belize and Belmopan to know that it has dropped and that whether the generator kicked in or not. So it's real-time monitoring to ensure that you can have vaccines at all time and there is no vaccine wastage. This is a fantastic partnership. And I believe that the people of August Pine Ridge will be really happy to know that this is happening. This is your facility. You can monitor to make sure it's functional, it's operational, and it's there for your children. It's my pleasure to say thank you again to all the partners and to the people around here, to the team from UNICEF who are also here to support us today, who have been very strong in engaging and making sure that this can happen today. Thank you, everyone, and I look forward to a wonderful afternoon together. Thank you.
Thank you. Thank you, Ms. Parker, for those very insightful words and very significant contribution, the report that was mentioned. Also, I would like to highlight that in completing my graduate studies, I did focus my thesis on woman empowerment and relationship power, and it also has a significant relationship with access to health information. So it is an important social determinant that we often overlook. So now we can get to the ladies in the beautiful dresses behind us and their hair design, which I am very impressed by. So we have the August Pine Ridge Cultural Group, and they will be doing a performance for us called Jesucita. So if you turn your attention to my left, So thank you to the Agas Pine Ridge Cultural Group for that beautiful rendition. Important to note that Ms. Hermanichi is our caretaker and also one of the performers there. Thank you. All right, so let's move on to the next part of the agenda. So, with the support of the government and the people of Japan, UNICEF was able to mobilize funding assistance needed to support the national response and recovery effort. We would like to invite Ambassador Shirakata from the Embassy of Japan in Belize to share some reflections. A round of applause, please.
Thank you very much. Muchas gracias. Honorary Kevin Bernard, Minister of Health and Wellness, Mrs. Alison Parker, UNICEF representative for Belize, Mr. Fred Luneau, Chairman of Village and other member of the Village Council, Dr. Edwin Brasting, PAHO Belize, Dr. Natalia Beer, Technical Advisor for Maternal and Child Health, specially invited Technical Advisor and Regional Health Manager in the Minister of Health and Wellness, and UN College from the United Nations Regional Coordinator's Office in Belize and UNICEF, and of course, student representative of the August Pine Ridge Arts School and the group of dance. Me gusta mucho de danza jesuita en Chihuahua. Sí. And the family of the August Pine Ridge community, we are joining us online on CTV3 and Facebook Media Correct. As you know, I prefer speaking Spanish, pero hoy hay que hablar inglés. Porque yo estaba en México y Guatemala, Costa Rica, y recién llegado a Belice. Nice to meet you. No, good afternoon. Good afternoon, and ladies and gentlemen. Firstly, I would like to extend warm thank you to UNICEF for organizing this event and inviting my team and I to commemorate this occasion. The government of Japan has made a significant contribution to Latin America and the Caribbean, including Belize, through the supply of vaccine to enhance the vaccine capacity and strengthen Belize healthcare system that saw a strength in the midst of the COVID-19 pandemic. Japan and UNICEF Belize partnered and delivered much needed cold chain equipment, which included 10 ice line refrigerators and 30 central temperature monitoring system for the proper storage of COVID-19 vaccine back in December 2022. I'm honored to be here today to witness the continued effort in strengthening the healthcare system countrywide and improving the quality of life of family in Belize through cold chain equipment and capacity building. A sincere thank you to UNICEF representative, Ms. Alison Parker, and her team for their dedication and support in strengthening the cold chain system in Belize. I'd like to reiterate Japan's commitment in assisting the people and the community in Belize in the further initiative for the improvement of primary health care and other challenges as it relates to humanity and a real democratization. Thank you very much.
Thank you, Ambassador Shikaraka, for your country support to our last mile effort in the pandemic recovery. Also, I am open to share a bowl of Japanese noodles one day, which is one of my most favorite Asian cuisine, right? So with that being said, we can move on to the second part. Published by UNICEF since 1980, The State of the World's Children is UNICEF's flagship report, the largest that they conduct. It seeks to deepen knowledge and raise awareness in key issues affecting children and advocating for solutions that improve children's life. This year reveals that we're facing a global and regional immunization crisis. To share the flagship report, its implications on children's health, please welcome Dr. Ralph Minde, UNICEF Regional Immunization Advisor for Latin America and the Caribbean. A round of applause, please.
Bueno, good afternoon, everybody. Honorable Kevin Bernard, Minister of Health and Wellness, His Excellency Ambassador Nobuyuki Shirakata of the Embassy of Belize, of the Embassy of Japan in Belize, my colleague Miss Alison Parker, UNICEF representative, Mr. Fred Renaud, Chairman of Village and other members of the Village Council, Dr. Edwin Bolastig, deputizing for Dr. Lewis Bell, PAHO representative in Belize, Dr. Jorge Palanco, Director of Hospital in the Ministry of Health and Wellness, Dr. Natalia Beer, a very old friend, Technical Advisor for Maternal and Child Health, Special Invited Technical Advisor and Regional Health Managers in the Ministry of Health and Wellness, UN colleagues from the United Nations Regional Coordinators, Office in Belize and UNICEF, student representative of the August Pine Ridge RC School, families of the August Pine Ridge community, viewers joining us online on CTV3 and Facebook, media colleagues. I have to say that I'm very honored to be here. And I think my colleague has said most of what I wanted to say regarding this report, The State of the World of Children. But this year, it's a specific report because it's really focusing on immunization. So I will be repeating a few things that you have already heard, but this report is really a call for action. So it doesn't matter because this will be repeated, until we reach the 2030 agenda. So what we observe in this report is that in Latin America and the Caribbean, coverage of the first DTP vaccines among children under 1 dropped 18 percentage points from 93% that it was in 2012 to 75% in 2021. This is the first time in all the history of immunization in Latin America that we have a steep decline. So it is important for us to take action to change the situation. According to the latest World Health Organization and UNICEF estimates, Latin America and the Caribbean backslide in immunization has left 2.4 million children, 1 in 4 children 1 in 4 children under the age of 1 unprotected from vaccine-preventable disease. More than 1.7 million of them are what we call the zero-dose children, meaning those children who had never received one single dose of vaccine. Diseases like diphtheria, measles, polio, once thought eradicated in many countries, are making a comeback across the region, putting the lives of most marginalized children and everyone's well-being at risk. Latin America and the Caribbean decline in childhood immunization may be driven by multiple factors. On the one hand, we think of natural disasters, violence, urbanization, instability, and migration have all contributed to growing inequalities. Uneven public spending in health across the region and reduced investment in some countries has left most marginalized communities cut off from quality primary health care. More, the COVID-19 pandemic exacerbated these challenges, interrupting childhood vaccination due to intense demands on health system and stay-at-home measures. There are also signs of declining vaccination confidence in some countries in recent years. The report highlights that immunization not only saves lives, but also is a proven strategy for reducing future health costs and supporting economic growth. Immunization generates strong returns on investment, as much as $26 per every $1 invested. To regain lost ground and ensure every child is vaccinated, governments and partners must invest in immunization and primary health care. We can prevent childhood disease now or all pay the price later. That's the choice that we have to make. To work to recover from backsliding and reduce the number of zero-dose children in Latin America and the Caribbean, UNICEF calls on government and partners to, first of all, urgently identify and vaccine all children, especially children in the poorest households. Indigenous children, Afro-descendants children who have missed their vaccination. Prioritize funding to immunization services and primary health care. Build resilient health system through investment in health workers, innovation, and manufacturing of vaccine supplies in the region. Lastly, strengthen demand for vaccines, including by building confidence. In addition to that, I would like to say that Belize has already started to make progress, and this is an opportunity for me to reiterate UNICEF support to the government of Belize in developing catch-up plan and continue to strengthen the cold chain system. I want also to take this opportunity to say a big thanks to my UNICEF colleagues, a special applause to Angela that has been leading this partnership and collaboration with the regional office. And also I want, thank you, Angela. And also, Mr. Minister, I'm hearing, in my briefing, all the efforts that you have made to put in place the quality improvement unit. I think it is key for the work that we have to do in the future, ensuring quality and adequate planning. Thank you.
Thank you, Dr. Mende, for walking us through the key findings and what they mean for our children's health in the region and, by extension, Belize. Children has rights too. I think we are all familiar with that saying. The highest attainable of standard of health and to facilitate treatments to illness and rehabilitation of health. UNICEF is committed to support the rights with the Ministry of Health and Wellness and my good friend, the Minister of Health and Wellness, Honorable Kevin Bernard, will continue to invest, we're putting you on the spot here, filling the gaps that have been identified in the primary health care. Our next item on the agenda is a video featuring chronicles the investment has made blasted by the Ministry of Health and Wellness. If you may turn your attention to the monitor on my right.
The COVID-19 pandemic was unprecedented in its impact. Globally and in Belize, all efforts were tasked as national governments and health partners collaborated and responded to save lives, retain hard-won development gains, and regain control over a reality that seems, at times, to be spiraling out of control. But UNICEF was formed for times as these, and the experience in Belize illustrates this. With support from access to the COVID-19 accelerator, UNICEF Belize has aided the country at every juncture, providing technical expertise, modernizing the facilities and medical equipment, and mobilizing resources to strengthen the national response and equip the health sector to better protect children and their families from the impact of the pandemic. And in Belize, all efforts were tasked as national governments and health partners collaborated and responded to save lives, retain hard-won development gains, and regain control over a reality that seems, at times, to be spiraling out of control. But UNICEF was formed for times as these, and the experience in the rollout of the COVID-19 vaccines and making increased testing possible for more of the population.
If you come to the clinic, you're being educated about the vaccine. I did it for me and my family and my parents.
As the country acquired vaccines to stem the wave of COVID-19, investments to bolster vaccine management and the national cold chain system were prioritized. Through 2021 and 2022, $924,000 was utilized to address these urgent needs to strengthen the national cold chain system, as well as risk communication and community engagement initiative.
UNICEF has contributed tremendously, I must say, as it relates to the child care development. UNICEF has also contributed to us a refrigerator, which we are greatly appreciative of, because we all know that the cold chain of the vaccines is very, very important. If the cold chain should break, then it will be of no reason injecting someone.
UNICEF is a stepping stone to us. Without that stepping stone, we wouldn't meet those targets. Either it being a poster for the public to get the information, either for it be a cooler for the vaccines to reach the villages. Without that stepping stone, we won't be able to meet those goals. Now, we need to make this more accessible. We need to get more staff on board. We need to get more medical officers, more nurses to be able to access at each village site.
Additionally, UNICEF procured 500 PCR and 20,000 COVID-19 tests and supported capacity building for laboratory staff to use their kits. This improved screening services and ensured samples were collected efficiently at all 13 district hospital laboratories and conveyed to Central Medical Laboratory.
Having the kits on hand readily available made it so that we were able to test everybody as we see them. And in that way, as a positive case comes up, we treat them accordingly. The kits were necessary because eventually we had to start swabbing every single person that came.
What began as an initial response to the needs of the pandemic has evolved, contributing to long-term improvement in Belize's primary healthcare system. Through the humanitarian support provided, UNICEF has contributed to building a responsive and resilient health sector with enhanced capacities of health professionals, modernized facilities, and increased quality improvement measures. 250 freezer tanks procured for temperature monitoring in the vaccine cold chain. 100 cold boxes of 14 refrigerators procured to store vaccines at a stable temperature to ensure that they do not degrade. 5 oxygen concentrators procured for oxygen therapy to manage COVID-19 patients with severe respiratory infections. 6,000 pregnant lactating women learned the importance of prenatal and postnatal care within a COVID-19 context. And 650 health personnel from 47 of the 57 health facilities trained in quality improvement. As we transition to COVID-19 recovery context, UNICEF pledges its continued commitment to prioritizing the health program and providing development support to national health partners. The New Country Program document 2022 to 2026 includes an amplified focus on primary health care with accelerated support to routine immunization and strengthening cold chain system for vaccine management. Because every child has a right to survive and thrive, we'll continue to support this partnership to strengthen primary health care in Belize.
August Pine Ridge, Nurse Gideon, Nurse Davil, and I hope I'm not calling everybody, I miss out anybody. I see Miss Mortis here, my good friend at the front, other nurses and Ministry of Health representatives that are out here, residents of August Pine Ridge, the students. As we are gathered here today, away from the bustling urban areas, we normally would have these ceremonies in town or in the city, in Belmopan. But it was very unique that we come to August Pine Ridge. We are reminded of the lasting impact of technical assistance and collaboration, which are essential in strengthening primary health care in communities like this one. Our partnership with UNICEF and PAHO has been instrumental in achieving these goals. 69 years ago, in 1954, UNICEF first pledged its support to Belize, focusing on environmental health, vector control, school feeding programs, and primary school textbooks. In 1981, the year of Belize's independence, UNICEF opened its first door, its office here in our country, solidifying its commitment to our people. One of the key initiatives in our partnership with UNICEF is the expanded program on immunization, which began in the 1970s. Immunization remains and continues to be a top priority for the Ministry of Health and Wellness. And I know I did not call her name purposefully in the beginning, as I acknowledge, but let me also ask the audience here to offer a big hearty round of applause to one of our hardest working employee in the ministry, Dr. Natalia Bear. We are grateful. If I can add the stories of the amount of hours she put in on a daily basis, you'll be surprised. Again, as I said, that with the support of UNICEF that we have gotten, our national vaccination schedule now covers 13 vaccines, providing protection against 13 vaccine preventable diseases. I would like to personally, on behalf of myself and the ministry and the government of Belize, express my profound gratitude to UNICEF headquarters and the UNICEF country office for their invaluable support in strengthening the expanded program on immunization, particularly as part of our response to the COVID-19 pandemic. Prior to the COVID-19 vaccination campaign, it was crucial to evaluate the cold chain network. With funding from UNICEF and the government of Japan, we were able to strengthen the network through the procurement of essential cold chain equipment and medical supplies. As a result, Belize now has the capacity to store any type of vaccine, regardless of temperature requirements. In addition to our work in immunization, the Ministry of Health and Wellness, in collaboration with UNICEF and other partners, established the Quality Improvement Unit in May of 2022, focusing on maternal, newborn, and child health. We are now considering upgrading this unit to a Quality Management Directorate encompassing all clinical settings and support services. We must be forward thinkers within the Ministry of Health. UNICEF technical assistance has also contributed to the success of the Baby Friendly Hospital Initiative, increased exclusive breastfeeding rates, and reduced stunting rates in children under 5 years old. I must say that just last week I returned from Barbados over the weekend, and Belize has been heralded for the many initiatives that we have been able to do, and thanks to our partners with UNICEF, PAHO, and other UN agencies who continue to support Belize in its efforts. Again, as I said, let me repeat that part that I said, that we have reduced stunting rates in children under 5 years old. Furthermore, our joint efforts have led to a decline in maternal mortality rates, with the last institutional death occurring in January 2022 and the last maternal death in June of 2022. I also want to take this opportunity, though, to thank those persons that are right here with us, our nurses, our community health workers, the people that are on the ground, going house to house, visiting our people at home. It is with your help that we are able to achieve these many objectives, and we are forever grateful. Just last week, ladies and gentlemen, and young students that are here, an independent team of experts evaluated Belize's system and structures for preventing transmission of HIV and syphilis from pregnant women to their newborns. I am pleased to report that the assessment team was satisfied with our progress, marking a significant milestone once again for our country. And while Dr. Bolstead is here, we may more likely very soon receive the certification of being a malaria-free country. Thanks again to all efforts of the people behind the Vector Control Unit and together with our support partners that we have been able to achieve such milestone in this country. In conclusion, I want to extend my heartfelt appreciation to the Embassy of Japan and the Government of Japan for their funding support. The UNICEF Country Office, Mrs. Parker, I know when we met initially, I was at the Ministry of Youth and Sports. So when I got tapped on the shoulder, say, you know, you're going to health, I said, well, I will take on the challenge, and together we are moving that challenge forward and turning challenges into possibilities. And that is what is important. And so, I definitely want to say, on behalf of myself as the Minister, Mrs. Parker, to UNICEF, to PAHO, to the Embassy of Japan, that it is my commitment and our team's commitment to ensure that we are able to achieve the SDGs by 2030. Let me thank each and every one of you today that are out here, because it's only together that we can do this. And so I ask even the parents that are listening, the teachers that are out here, look around your community and let us ensure that our people are being vaccinated and are being immunized across all levels of vaccination that we have available for our people. Thank you very much, and may God bless each and every one of you.
Thank you, Minister Bernard, for those very moving words. And just to reiterate and highlight the importance of what it means for a country to be classified as malaria-free, or to be classified that there is no longer transmission of HIV and syphilis from the mother to the child. Those are tremendous milestones in a country health system that many nations can only dream about. And the point that was made regarding the selection of the venue for this ceremony was very interesting for myself also. But then again, I remember that the people from Agaspine Ridge are a very different group. The essence of culture is strong, and the wind blows different, if you notice. The sun is always shining here, but it doesn't feel so warm as it would in the town. And because we can't get enough, we will ask the Agaspine Ridge Cultural Group to shower us with one more performance, and this one is called Baile Papusita. Pupurita, I'm sorry. I like to eat papusas, and they sell good papusas here. Once again, I would like to thank the group for putting together these performances and some entertainment in today's program. Now, at this time, we will recognize the official launch of the State of the World's Children 2023 publication. UNICEF representative to Belize, Ms. Alison Parker, will make a presentation to the Minister of Health and Wellness, Minister Honorable Kevin Bernard. So,
Don't worry, it was just a little ant bite I was managing, so. Minister Kevin Bernard, on behalf of UNICEF and the partnership that we've nurtured over the years, we want to present to you, for the first time, the very comprehensive State of the World's Children's Report on vaccination. We hope that this will be a tool for advocacy, for leveraging resources, and for nurturing partnership to make sure that every child in Belize can survive, thrive, develop, and contribute to our economic recovery. Thank you.
thank you. For those of you who are interested, you can download the publication from the QR code on the agenda, or you can visit the UNICEF Belize website, www.unicef.org/Belize. And now for one of the main event for today, the handing over of the equipment, of which I can briefly go through some of them. I was very impressed to my visit to the Ministry of Health, the vaccine building, which is, I think, one of the most advanced building I have ever walked in, fully digitalized vaccine rooms. So that was one of those initiatives that was realized through this funding. We have the ice line freezers, a variety of freezers, which are distributed throughout the country. We have the generators, of which we have one here in Agaspine Ridge, and the second in San Felipe. Temperature monitoring devices, which alert us, the primary users, whenever there's a decrease in temperature. The 2013, I need to emphasize, recent 2013 Toyota Hilux, of which 2023, sorry, which are behind us. So we have 2 of those assigned to the Northern Health Region, and yet to realize are some golf carts to reach those hard-to-reach communities. There's also the launch of a vaccine application, which will be used by the nurses to have a better data management of those vaccines. Among other medical equipment, such as pulse oximeters, oxygen concentrator, delivery beds, and other supplies. So I would like to once again invite our invited guests as we move forward to the ribbon cutting in front of the vehicles. We do not have all the, okay, so we will move past the ribbon because it's a bit hot. The sun is, but we would like to hand over the keys. So if you could come to the front.
Honorable Minister Bernard, on behalf of UNICEF, it gives me great pleasure to hand over the equipment and supplies that have been listed. And we want to use this opportunity to again thank the government of Belize for their amazing partnership and to the government and people of Japan for their contribution. As my colleagues have mentioned, we commit to continue to invest in primary healthcare in Belize to make sure that we can reach every child with the basic social services that are needed for them. Thank you for this lovely partnership, and I look forward to joining some of the mobile teams as we go into the households to give the children. These are the two cards.
I also want to take this opportunity to once again thank the UNICEF country office and the regional office, of course the Embassy of Japan, and reiterate our commitment in Belize to ensure that no child is left behind. I thank you very much.
All right, thank you. So this would be the last activity for today. The Standard 6 students from August Pine Ridge RC School are here with us today, and thanks to the leadership, their principal, Ms. Blanca Torres, who facilitated the school participation. For the past week, the school held a poster competition to commemorate the occasion for students from Standard 4, 5, and 6. And they will be presenting today the 3 posters that were selected to depict the importance of vaccine. So with that being said, I would like to call the 3rd place winner, the student by the name of Dana Torres. Dana Torres. So Dana, can you please give us a quick example of what the poster is and the meaning of the art behind it?
Good afternoon, students, and good afternoon to our invited guests. Today I'm going to be presenting importance of vaccination. Vaccination is important to prevent disease, and it helps our health to be at a good state. We can go to the doctors or we can use medicines. That's why the clinic is back here so we can come and take vaccines. Thank you.
Thank you. So Dana will be getting 1 school bag from UNICEF and $50 gift certificate for school supplies. Congratulations. The 2nd place goes to Kaylee Chan. Kaylee Chan. So Kaylee, can you do the same and explain to us your poster?
Good afternoon, everyone. We did a presentation on vaccination. We worked really hard on this poster, so I appreciate getting 2nd place. The importance of vaccine is that it protects us from types of disease and viruses. We need to seek help in case we get any of this sickness, we come here to the health center to get medicine or any type of help to help us take away the disease. Vaccination can protect us from hepatitis B and any type of viruses. Thank you.
Thank you, Donna. So, Donna also won a school bag from UNICEF and $75 gift certificate for school supplies. And now, drum roll. It's okay, no drum roll. But this one was a partnership between Milady and Amilady. They won, Medellin, sorry. They won the first place prize. So can these two students come to the front? So can one of you briefly explain your poster?
Good evening to one and all. Well, we did a poster on the importance of vaccination. So we have the first sentence over here. Spread the word, not the disease, that can harm or kill babies, children, and adults. Get vaccinated for the flu, or you'll get it too. Help your body create protective antibodies, proteins. A vaccine today keeps the virus away. Thank you.
Thank you. So the duo will be getting a school bag from UNICEF and $150 gift certificate for school supplies. There were also other competitors, and we would like to thank them for their submissions. So, and with that, we have come to an end to our event. Thank you all for being so attentive. The ceremony is over, but the work must continue, so that every children have access to the highest quality of health care and facilities so they can survive and thrive. We count on all our partners to achieve this quest. Good evening, and thank you to all our special guests.